Hi, I'm so glad you're looking for a way to gain back control of your healthcare or support for a loved one. Can you relate to this? You show up on time for your doctor's appointment, but then you have to wait 15, 45 minutes, maybe even an hour before you get to see the doctor. Then you feel like you're rushed and it's impersonal and your doctor doesn't really care about you. You're just another appointment. Then before you know it, he's got you on all kinds of medicine that doesn't even help, and it may be causing other problems instead. Perhaps the doctor's words are disheartening or scary, and you don't understand what he's saying, and he doesn't want to take the time to explain them to you. And the worst part, you are missing out on life. You are skipping out on friends, lunch dates, family get-togethers. You feel like you're a burden to other people because you need help maybe with meal prepping or your medication. Even if you have a lot of medication, you may not even know what to take, when to take. You're tired of being the sick one, always needing help from them. What if I could tell you that all of that could change? Just imagine you walk into the doctor's office feeling confident. The doctor actually listens to your concerns and has a good communication with you, and you start talking about all the options that are available. You go from feeling scared to overwhelmed. You also feel confident in making decisions that work best for you and your family. You feel so great that your friends are even asking you, what is going on? What happened to you? You look so great. You feel so good that you are now helping them instead of them helping you. Did you know there are about 10,000 different types of diseases, but there's only 300 symptoms that go across the 10,000 diseases? Because of that, 1 out of 20 diagnoses are incorrect. It is very critical that you and your doctor are on the same page and understand what's going on with your health. Having a trusted companion by your side in those doctor's appointments can help with that. You can ensure that you're getting the correct diagnosis. Not only that, 73% of patients say that working with an advocate felt supported, empowered, and less vulnerable. And a whopping 92% of patients and 98% of doctors agree that having an advocate in the room positively impacts the outcomes. My friend, I totally understand, and I am here for you. I am willing to be your patient advocate. For the last 26 years, I've been advocating for my son who was born with spina bifida. He is paralyzed, waist down. He uses a wheelchair for mobility. He has had over 50 surgeries and has a regular visits with a myriad of doctors. He sees a neurologist, a neurosurgeon, a urologist, an orthopedic doctor, a nephrologist, all of these specialists he sees. So we faced numerous hurdles, but let me tell you, the doctors said that he might not live past 20, and I refused to accept it. I did everything in my power to make sure he could have a good, decent life. Now, despite the odds, he is now 26 years old. He is living on his own with minimal support, and he is actually working as a host in a restaurant, and he is an athlete leader and a health advocate for Special Olympics, and he advocates for those with disabilities through the Franklin County, Ohio, to be more active in the communities. In 2007, my father experienced chest pains, but each doctor passed it off as it wasn't their responsibility. He went into the ER. The heart doctor said it's not his heart. The general doctor said it wasn't something that they could do. He saw so many different doctors, and unfortunately, I was unable to be there for him, and he passed away in ICU just 10 days after he went into the ER. Before passing, he did ask me to help take care of my mom. She is as stubborn as I am. She hates to admit that she needs help. She has type 2 diabetes and heart disease, which before my intervention, she was going to the ER at least once a month. Now, in the last 2 or 3 years, she's only been to the ER twice. And my husband had type 2 diabetes. Doctors attributed his persistent foot ulcers to his diabetes and proposed amputation. They wanted to amputate up to his knee. For about 5 years, the doctors kept cleaning the foot ulcer and removing pieces of his foot. It started out with a bone on the side of his foot and then slowly went to all of his toes. Now, when they couldn't figure out what was going on with the ulcer, they wanted to amputate his leg. So we decided that we didn't want to do that. We wanted to see what else could be. So thankfully, we sought a second opinion and found a doctor who wanted to get to the root cause. The root cause was not his diabetes. It was the bone structure in his foot. So the doctor corrected that and was able to save most of his foot and definitely all of his leg. And he is out and about now and moving around. The doctor was so impressed with him that he is using him now for different types of prosthetic testing for his shoe, so he can encourage other people to be more active after these types of surgeries. In an ideal world, everyone would have a patient advocate, and I'm here to be that for you. So, if you're ready to take back control of the medical decisions for you or your loved one, I would love to meet with you. Just click the link below and schedule a 30-minute consultation. After that, we'll schedule an intake meeting where I will get more information from you, more specific details about your medical history, your concerns, and what your outcomes would like to be. From there, we'll create an action plan and you'll have options for my one-on-one services, like assisting with coordinating your doctor's appointments, attending doctor's appointments, weekly check-ins where I will give you a call or have a visit, an in-person visit. We'll have medication reviews and have a medical history report for you to take to any new doctors. We'll have an emergency face sheet, so if you ever have to go into the ER or call 911, all that medical information is there on one page. So if you're ready, click the link below to schedule your 30-minute consultation.